Hey everybody, it's Dr. Ian Stolman, and this week we've had a couple of people approach us with some questions and concerns about some recent reports about children having these complications associated with coronavirus. I think it's really important for you to be able to understand what's going on and put it into the greater context of everything that we've talked about over the last couple months. Now, we've been lucky because, for the most part, COVID-19 has spared children. Less than 2% of all COVID diagnoses are in people under the age of 18. And it's important to understand why. Coronavirus, for the most part, is pretty mild or even asymptomatic in healthy people. The people who are typically diagnosed have relatively severe cases, certainly in the US where testing wasn't available for quite some time. And what we were seeing is that the people that were being diagnosed often had pre-existing conditions, cardiovascular disease, obesity, high blood pressure, low vitamin D levels, all of which are more prevalent in older people, less prevalent in children. And so it really surprised ER physicians in New York City when they noticed a handful of kids that were coming in with these inflammatory processes. Basically, these kids would have what they referred to as pediatric multi-system inflammatory syndrome, which means there were a bunch of different parts of their body, their skin, their digestion, their hands, vascular system, and they were all inflamed. And it was actually pretty similar to the symptoms of Kawasaki disease. And so they were concerned about it, the dozen or so cases that they found, and they assumed that it must be linked to coronavirus, right? New York City being the hotbed of coronavirus activity. The problem is when you look at the reports, about a third of the cases had an active coronavirus infection. Another third had a previous infection, meaning they had a titer, an antibody titer, which means they'd previously been exposed to coronavirus and had gotten over it. And then another third of the cases didn't have any coronavirus activity, right? And so I think that the reports that were being sent around the interwebs seem to be a little bit sensationalized because it doesn't seem like it's that linked to coronavirus. So I think that's pretty important. The other thing to keep in mind is this is incredibly rare. We're talking about a dozen or so people out of a city of 8 million. So this isn't something that you or I really need to be concerned about in terms of our children, but we should know what's going on. I think the bigger concern here is not necessarily exposure to coronavirus. I think it has to do with inflammation. Now, why is that important? Well, inflammation is necessary for our bodies to help it recover and help us heal and fight infection. But when there's too much inflammation, it can actually interfere with normal function. It can cause issues. Now, that means in terms of protecting your child from this complication or this rare disorder, what you need to do is focus on how you can reduce your child's inflammation. And this is where I feel like I'm beating a drum every week. Your child's lifestyle, your family's lifestyle is key. If you are eating junk food and sitting on the couch all day and staying up all night and not getting adjusted and not taking supplements and generally not taking care of yourself as well as you should, your inflammation is going to be higher, particularly in an environment of high stress physically and emotionally, in an environment where vitamin D levels are low because of being stuck indoors, especially after a winter, as New York City, the case has been. So if you made different decisions, if you were more conscious about your choices, if you ate good nutritious food and got plenty of physical activity and made sure that you and your family had restful sleep and you got adjusted and you took good supplements and you made sure your vitamin D levels were nice and high, that is going to dramatically reduce the amount of inflammation in your body, and it's going to make it so that your body has a more appropriate response to being in contact with any sort of virus or bacteria, whether it's coronavirus or something else. And I think that's the real key here. It's easy to get scared or be frightened about new information, especially when presented in a very sensationalized, dramatic version in an effort to attract people to view your story, right? But the truth is the cases on the ground don't really match up with that level of fear or panic that's going around. And so you can't control exactly how your child is going to respond, but you can mitigate the risk by focusing on their lifestyle and focusing on reducing inflammation and increasing resistance through what we've been talking about for the last couple months. Eat well, move well, sleep well, get adjusted, and let your body have a greater capacity to adapt to all of this that's coming around physically, emotionally, immunologically. That's the real goal here. So, to summarize, this pediatric multisystem inflammatory disorder, the syndrome, incredibly rare, may or may not be linked to coronavirus. We're not entirely sure at this point. And I think probably has more to do with inflammation than anything. So focus on reducing the inflammation and taking care of yourself. And if you have any questions, post them below or reply to the email that I'm going to send out. And I hope you guys are doing well, and I'll see you next time.